Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you.
Good afternoon, folks. This is Dr. Shailinder Sodhi along with my co-host Dr. Anju Sodhi. And say hello, Dr. Anju.
Hello, everyone.
So, today's topic, we have a very interesting topic. Before we go on our today's topic, which is rheumatoid arthritis, I want to give all the listeners phone number to call us. And to call this show, Your Body's Natural Pharmacy, the number is 1-844 301 1250 1-844 301 1250, and that's our direct line here to the studio. And Andrew is just the other side of the studio, who will be picking up the line and transferring your calls to us. It's a big shout out for Andrew. He's doing a great job. We've been working with him almost over a couple months with him. And also, so Dr. Anju, you and I have been practicing for over 24 years at Ayurvedic Naturopathic Medical Clinic in Bellevue. And I'm sure you have seen your share of rheumatoid arthritis.
Yes, I did, Dr. Shailinder. And we had some, it's really like the complicated, we do get results and sometimes we do not get results.
Right. So it's one of those conditions where we have to work with the patient to patient. It's not that it's not going to be every patient not going to be 100%.
Going to be same, and it's very important that they follow up. Like if we do not know what is going on, and it can take months to years before we really see the difference sometimes.
Right. So, folks, we are talking about rheumatoid arthritis, and we will just go a little bit more in detail. We have our success stories at our clinic where the patients are gone completely into remission, and others who, had something left on and they were kept on reminded by their body that it's not completely gone, but they felt better. So today's the hour which we're going to devote to the rheumatoid arthritis, we'll be discussing about what really rheumatoid arthritis is, and who are more prone to get this, and what are your options. So Dr. Anju, as you know, the female are more prone to get rheumatoid arthritis.
Yes, and I had all my female patients with the rheumatoid arthritis.
And, so this is the more common, but I also have seen male but
too.
not
I
as
haven't
much.
seen, but you might have seen the male too. But
Yeah.
it's more common. It's 3 times more common in the women than men. And also the genetics play a role too. So if it's in your genes, it's possible that the women more than men can be affected from the rheumatoid arthritis.
So also it can happen at any age. The most commonly it happens from 40 to 50 years of age, but juvenile rheumatoid arthritis, we have seen a few cases at our clinic. And that can happen as well. So what does that tell you? That it can happen at any age, but most commonly 40 to 50, and women more prone to have rheumatoid arthritis compared to men. And usually when they start, it's usually very quick start. All of a sudden onset of chronic severe joint pain and inflammation.
Yeah, and it starts with the small joints and then it goes to the big joints. If women women or men start feeling some stiffness into their hands and feet, and in the beginning, sometimes it can take years before they get diagnosed that they have the rheumatoid.
Right, and it's like a body. Sometimes those tests which are very hallmark test, they do not show up positive,
yes.
and that's the common thing. So folks, if you know someone or if you have rheumatoid arthritis, please feel free to call us at 1-844-301-1250. My daughter Khushbu and Mehak said, Dad, make sure you repeat the phone number more often. You guys are not telling the phone numbers. People have tough time remembering the number. So आप हमारे साथ हिंदी में और पंजाबी और उर्दू में भी बात कर सकते हैं. आज का टॉपिक है रूमेटॉइड अर्थराइटिस. कॉल करने के लिए 1-844-301-1250 पे आप फ़ोन नंबर घुमा सकते हैं. एक बार दोबारा मैं ये नंबर बोल रहा हूँ, 1-844-301-1250, 1-844-301-1250, and you are listening to Your Body's Natural Pharmacy, and we're discussing about rheumatoid arthritis. So like Dr. Anju, we were saying that, the women are more prone to, but the other thing which can happen, there are some vague symptoms like fatigue, low-grade fever, weakness, weight loss, joint stiffness. These can be coexisting before it even get full-blown diagnosed. That that all of a sudden patient notice that they have swellings in the fingers or in the hand or in the
they start
joint,
feeling like as you said, like fatigue. They start feeling more lethargic, especially when they get up in the morning. They don't feel energized, and they do feel like the morning stiffness into the joints too. So these are some early symptoms.
And these symptoms can last for months.
Yes, this can last for the months, and it can be due to some other. It's not necessarily that it's due to rheumatoid, but it can be due to some other factors too.
Right, but if you got a family history, which is
Yes.
if there is someone in your family or mother or grandmom had rheumatoid arthritis, and you are having noticing these symptoms, it's better to go and check with your primary care physicians, and to make sure you don't have rheumatoid arthritis. So you don't want to ignore it, because in early interference
Yes.
have shown to given a better results.
Better results. And we will be going a little bit later into the diet section and what you can do to prevent it. But in the early stages, as Dr. Shailinder said, it can trigger from some dietary factors, and due to some in the men, especially with the smoking, and there is several factors. So in the early, if they see some physician in the early stages, there is possibility
to reverse it, actually,
reverse
almost
it.
that
Yes.
you can put a stop to it. And the other the scary stuff with the rheumatoid arthritis, as you know, Dr. Anju, is that sometimes there can be vasculitis, which is just inflammation in arteries, and
Yes.
that can happen. And also granulomas can develop. Those are the small growths in the body that can happen. Those, they are benign. And the other thing is very painful, pleurisy, which is a lung condition,
Yes.
and that is no fun to have. It's really very painful. And sometimes, I think the one case I remember, that was the only thing. He came in with the pleurisy, and once we start investigating, later on turned out to be he had an autoimmune response, and turned out to be it was the start of rheumatoid arthritis in this gentleman. So other thing also which can happen, coexist, which is even more scarier, is in the inflammation of the around the heart, we call pericardium, which is a covering sheath around the heart, and it can swell, and we call it pericarditis. That can be very severe emergency. You can go into in fibrillation, if it can happen, or
Yes, that is true.
and tachycardias can happen. Pulmonary fibrosis in severe cases,
That can be.
other thing. And then the other thing is like splenomegaly, which is an enlargement of the spleen, which makes it more prone. If you get hurt or injured, you can have severe bleeding from the spleen, because it's been enlarged, and that can put into a very life-threatening situation. And beside that, enlarged lymph node all over that. These are the symptoms which can coexist with rheumatoid arthritis. So, folks, if you know somebody or you having it, and you have question about it, please feel free to keep us calling at 1-844-301 1250. Again, 1-844-301-1250. And the diagnostic criteria, like we said earlier, that it's not always possible that you're going to have rheumatoid factor positive in early stages.
Yeah, that's why we sometimes, like, if someone is having showing some inflammation into the body, stiffness, it's important to, like, sometimes people don't go for just a routine blood test too. So if someone is going for a routine blood test, we recommend every year. So that can show, like, if it is some sort of inflammation, then you can go for and even if you have the symptoms, then we can do the more specific tests.
Right. And usually it's confirmed once we have the rheumatoid factors are positive in the blood. And we also call anticyclic citrullinated peptide antibodies, or we call anti-CCP test. And once these are positive, then it's usually confirmed along with the ANA, which is the anti-nuclear antibody test, giving a indication that there is a autoimmune response.
Yes.
So we really don't know what really triggers it. That's the confusing part about majority of autoimmune diseases, and especially with rheumatoid arthritis. Other than what little we know about it, what can be triggering factor. So those are the things which I think we want to let our listeners know, that it can happen. And it's one of the most common form of inflammatory polyarthritis. That means multiple joints get involved, and usually, like you mentioned, it's a small joint. It can happen with the wrist and the hands and the fingers. Sometimes can be spared, but they can get involved in it.
Yes.
And these are the very early stages. Sometimes people just notice stiffness, and especially with weather changes.
Especially with the weather changes in the winter season, they sometimes in the summer too, but in the winter definitely they see more stiffness into the body. And I think with the Ayurvedic point of view, it's a more kapha too, and that can be, like, if they are not taking care, or that can trigger it even more, or they can have the flare up in the winter time too.
Right. And though again, whenever we consider Ayurvedic imbalances, it's usually tridoshic imbalance. It can involve into any of the three doshas, and they can trigger into each other and leading it to the autoimmune response. But you're very right. It can be majority time can be kapha imbalance in the body. And the other thing is, which we want to see is, sometimes the RA is very gradual. It's just slowly, and over the years,
yes,
it becomes a very much clear picture. So people can say, oh well, it comes and goes. That's a very classic picture of rheumatoid arthritis. The only time when I saw it was very abrupt was in this juvenile case. Who this little boy who was only about 12 or 13-year-old, and his symptoms start showing up once he was given a vaccination, and that's when it triggered. Though there is no co-direct relationship with the vaccination and causing rheumatoid arthritis, I want my listeners to understand that. But if there is genetic component, there are triggers which can happen sometime with the vaccination in rare cases, and there are a few documentation cases where it can happen, especially with the old-time vaccination, where we had methyl mercury as a preservative, and the mercury being cited to create that type of imbalance in the body and start the autoimmune response in these individuals. So now, once we corrected the diet and lifestyle, definitely this young boy turned out to be fine in later, and I haven't seen him for a long time, and I'm hoping that he is living pain-free. But these type of cases can happen with some sort of triggers.
Yes.
And the triggers, like earlier you mentioned, that the environmental factors and genetic factors. If you have a genetic factor and you are a smoker, you are, like you mentioned, about 8 times more?
Yes.
It's about 8 times more prone to get
get the RA.
RA.
And if the positive family history genetics, so then it's more for the like the RA or the autoimmune diseases too.
Right. So if you're carrying a RA gene, rheumatoid arthritis gene, and you most probably, if there is a family history, there's a greater probability that you also have that RA gene positive, and so that can, with the smokers, can bring this type of imbalance, and they can trigger it and start having autoimmune response and the swelling in the joint. The other thing which we notice is not only environmental factors smoking, but other factors like having socioeconomics issues and poor diet leading to the families who are nutrient deficient food they're eating.
Yeah, and the more Western diet, like the people eat more Western diet these days, and that can trigger into the autoimmune diseases
right.
too.
And in one study, there was an indication people who drink more than 3 cups of coffee in a day, and if there is a genetic history, they are looking for a trouble. So, folks, if you are addicted to the coffee and you have a RA gene, or if in the family the positive for rheumatoid arthritis, the one of the recommendation I usually give, cut down coffee.
Cut down the coffee.
You don't want to drink 3 cups of coffee, or maybe 1 cup will do a job if you really need it. But on the other side, green tea have shown to be effective in rheumatoid arthritis.
Yes.
So there is something with the green tea which comes with all the bioflavonoids, catechins and epicatechins, which have a protective and anti-inflammatory effect on the body. So that really reduces the inflammation in the rheumatoid arthritis patients. So other also is psychological factors. If you are an individual who is constantly under stress for either family reason or job relation or relationship issues or job-related issues, you are going to trigger these factors. Or the individuals who do not take enough rest, so that also leads to the stress cortisol's elevations in the body, and again triggering the autoimmune response. Dr. Anju, what is the autoimmune response? Just for my general public, I will let you just explain so people understand what we are really discussing here.
So body starts making antibodies, and that our system cannot recognize it, and then it starts fighting, and then that's called the autoimmune.
So in another way, what you are saying is that our own system is fighting for our own.
Yes,
do
not recognize it.
Our own system doesn't recognize us and start fighting within it.
Yes, so that's that there is a several type of the several rheumatoid arthritis is a one which fall into the category of the autoimmune diseases, but there is other two, so which we will be covering in the next few weeks or so. And also, Dr. Shailinder, for the women, as I talk, the women are more prone to the rheumatoid arthritis. Estrogen play role too.
Right, and that's probably the reason why women are more affected by rheumatoid arthritis, because estrogen has its role, and it's usually imbalanced in these cases, and they develop rheumatoid arthritis.
The estrogen levels are high usually into the women with the rheumatoid arthritis too. And then there is the other factors too, like the diet is a very, the diet with the poor diet, or the diet rich in the meat and the low in the vegetables and the fruits and the low in the fiber, that can lead to the inflammation too. So body starts making the more inflammatory response of the body, and that can also affect into the rheumatoid arthritis too.
So what you are just saying is the diet which is lacking all the nutrients, antioxidants.
And these days people do eat lot of that Western diet, or they do not eat, they eat lot of processed food, and they eat do not eat enough fruits and vegetables, which is very important. As all the nutrient, it's a like in the rheumatoid arthritis. Like other thing is like it's a lack of the multiple nutrients too, like vitamins.
Which leads to an oxidative stress, we call.
Yes.
That means low level of nutrients in the blood, which will lead to inflammatory response in the body.
And on the top, if people are not eating healthy diet and they are not taking the supplements into the diet too, so with the positive factors that can lead to the rheumatoid arthritis too.
Like you were mentioning when we were driving to the studio, the saturated fats are known to be causative factors which leads to rheumatoid arthritis.
Which leads to the rheumatoid arthritis So olive oil is shown to be, because it has all the omega-3, omega-6, omega-3 fish oil, olive oil is good into the rheumatoid arthritis, but other fats, Dr. Shailinder, can alleviate or it can trigger, like if people are eating a lot of fat, it can trigger the symptoms too.
Right. So the folks, the key is the saturated fats are not really recommended here, but much more we like to see something like olive oil or the fish oil are much more on the beneficial side to take. So we are going to take a short break and we'll be back. We are discussing rheumatoid arthritis, and phone to studio is 1-844-301-1250. Again, 1-844-301-1250, and you are listening to Your Body's Natural Pharmacy.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Along with my co-host, Dr. Anju Sodhi, and we are discussing rheumatoid arthritis. I hear that there is a caller on the line. We will take the call, and then we will resume our topic. So caller, go ahead. This is Dr. Shailinder Sodhi on the show Your Body's Your Natural Pharmacy. Caller, go ahead.
Hello.
Yes.
Good afternoon, doctor.
Good afternoon.
Yeah. So actually, my wife is having rheumatoid arthritis with a self antibody syndrome called estrogen. Actually.
Yes.
So we were moved to Seattle last October, and after that, she got the body pains and all. So after several tests, they detected that there is a rheumatoid RA factor, which is about 10 to 15, I think. I did not remember exactly. So doctor also suggested us to take the rest. So that's the reason why I just dropped my wife to India actually. So can you please suggest us, so we don't have much information about this thing, and to be frankly, we don't want to use the allopathic medicine. So do you have anything, any recommendation for us?
Yes, definitely. You know, like you mentioned, her symptoms got triggered a little bit more as soon you moved to Seattle. The change of environment factors have.
Where did you move from?
Directly from India.
Oh,
okay. So that's the reason. The one of the environmental factor we were saying in earlier our talk, that the cold weather actually known to trigger these symptoms more vigorously than the other changes. So if there is a genetic history, which may be in your family, wife's family side, will be. So these are the factors, along with the change in diet and environment and moving to new country, going through the stress, that probably trigger all these things. So your question is that you don't want to be thinking of doing all the time the allopathic approach, where the medications or the immunosuppressive therapies, which sometimes are recommended in this case, to avoid the rheumatoid arthritis like symptoms. I would say continue to listen to the show. The best thing for you, like we mentioned, you need to have, we emphasize quite a bit on the diet, which Dr. Anju is going to cover later in the show, and also making sure the antioxidants are present. And we also find that people who are vegetarian, doing much more Mediterranean type of diet, a little bit of fish in the diet, have been helpful in controlling the symptom. I hope your wife is can eat fish. If she's a vegetarian to begin with, then we will advise what type of vegetables and the other things she can have, or people like
She's
her.
vegetarian.
Right. So that actually goes in her favor, but we will tell you what type of things she can add to minimize her symptom. In a way, I'm happy that you have dropped her back, or she went back to India, because the warm weather will definitely cut down some of her symptoms, but not necessarily, because we, like I mentioned, environmental factors, if the pollution in air and the water and even in the food can be trigger factor.
Yeah, in India also, like the food is like over here, it's very important in this the rheumatoid arthritis to eat the clean food, means like the organic foods are the best without pesticides. And in India, the problem is like they are using a lot of pesticides too. So my recommendation would be that you tell like your wife, like they need to get the food if it's should be organic over there too.
Right, and if you have a small piece of land behind
Yeah.
your house, growing your own is the best way these days. But I mean, not everybody is able to do those kind of things. So my recommendation again, looking for a very clean food, organic beans, organic milk, or organic grains, everything organic. Less of chemical pesticides and purified water. That means make sure the water which she is going to use is coming from the filter, and because even water in India have polluted
Yes.
now. So and we drink quite a bit water, so that can be factor in it. So these are the things which I will in generality will advise, along with making sure she does yoga routinely, because that will continue to keep her flexibility. Because one thing which happens is the stiffness of the joint,
Yes.
Dr. Anju, as you
So
know.
especially in the morning stiffness, so physical activity is very important. Like you mentioned that for the rest, yes, rest is important, but same time some sort of exercise like the yoga is a very gentle yoga would be very helpful to her, and doing some pranayam would be really helpful to her.
And giving her a good multi along with the other supplements, which we'll be covering in later a portion of this today's topic. Please keep listening, and you can take all those notes and let your wife know. And feel free to call us at any time at our clinic if you need to. Our clinic phone number is 425-453-8022. Again, clinic number is 425-453-8022. So thank you, caller, and we will continue with our topic of rheumatoid arthritis. So other thing which Dr. Anju we have found, there is a infection and cross reactivity, the microbial issues at the gut level, that sometimes people who had some sort of infection, gut infection, that had triggered the rheumatoid arthritis.
That does trigger that can too, like these days, like the SIBO, which is the small intestine bacterial overgrowth, which is like the really common these days too, can also trigger into that too.
Right, and the people with these type of things, even though I'm not a big fan of doing a whole lot of antibiotic, but they do improve with the some of the antibiotics given or antimicrobial given, and their symptoms do improve. But we do have similar approach with the herbs
But
and
with the Ayurvedic herbs too.
which can give the same result. And other thing is dysbiosis. Dysbiosis, along with the you already alluded to the small intestinal bacterial overgrowth. So what is dysbiosis, Dr. Anju? It's just like an imbalance of the flora at the gut level.
Imbalance of the flora, and sometimes like by taking people take the antibiotics for the several reasons. If they got like flu symptoms, even if it's a bacterial or viral, they do not
People
know.
just like
people
to,
like to, and if they go to the regular doctor, they do like to go to give the antibiotics.
Not always, but it's
Not
like
always,
some
but
patients sometimes ask for
yes,
it,
and
we get under pressure that we have to prescribe,
and
because
we do
patient
get those type of patients too, like they are not getting better and they want to get the antibiotics. Doesn't matter if
right.
that is
And
going
if
to
you
help or
have been
not.
given antibiotic as in your growing age, that will cause a dysbiosis in the gut. And that means we have lots of healthy flora, which actually within our gut has its own universe, which helps us to digest our food and helps to make us B vitamins and folic acid, other vitamins, and which helps to digest and also keep us regular. So sometimes these antibiotics, it's like using a nuclear bomb.
Yes.
They don't spare good versus bad, and that creates the entire population of the flora destroyed, and or leaves very little bit of the good flora, which is not good enough, and leads to an issue of dysbiosis, which leads to actually starting with the cascade of allergies.
Allergies and then the inflammation
Right.
with this.
So when we talk about the cascade of allergies, what I mean by that is that our intestines permeability
Yeah.
get compromised. That means all of a sudden here we are, the food which we used to eat, enjoy, are not getting broken down, and the
Yeah.
large molecule getting passed into the
Passed
circulation.
into the circulation. So what are the main allergens? Like then the wheat is the main allergen.
And there have been indication that gliadin have
Yes.
been, which is a part of wheat, is actually culprit behind leading to the rheumatoid arthritis. So people who avoided gliadin, and also people who actually in general, the best thing is to avoid gluten and the wheat completely, or any food which contains these components, then they shown to improve.
They're shown to improve. And then the other allergens are the corn is a allergen too. So
Even though it's a gluten free,
even
but
though it's
it
a
is
gluten free, but like the people with the autoimmune or the rheumatoid arthritis especially should not be eating the corn.
right. And we don't know why is that, but I think maybe because we have modified our
Genetically,
grains,
GMO is the one
GMOs.
factor too.
Right, and that
maybe the sugar content.
the sugar content of corn is usually high. The one those sweet corn we love to eat in the summertime, could be that factor. Again, all these are
Anything,
modified. It's not the original. The other thing, all these adverse reactions to the foods is basically reason is that gut health
gut health.
is not proper, and that's the one thing which in Ayurveda we say majority of these things start from the gut.
Yes, and at our clinic, whomsoever we get the patient, whatever reason they come from, we start from the gut.
Right. We work with the
You
digestive
work with the
system.
digestive system first.
Yeah, we make sure that your liver is functioning well, your kidneys are functioning well, and your digestive system is good, and your lymphatic system is good. Like earlier in the talk, when we started today's topic, I mentioned the organs, like these organs do get involved. From the lungs to the lymphatic systems to the liver to the spleen and the gut, all these things can get involved. So the Ayurvedic approach is usually, all right, let's make your digestion strong.
Yes.
When we're talking about making digestion strong, that's like we are working on the digestive fires, right? We are talking about making sure your acid production in the stomach is proper, because that's a key thing when we're trying to break down the proteins. And protein digestion is very important when we're discussing about rheumatoid arthritis or any autoimmune, right,
Yes,
Dr. Anju?
yes.
So the hypochlorhydria is a technical
Yeah.
terminology which get used. That means you have too little acid, or we call in Ayurveda too less of pitta.
Yes.
That mean which will interfere, and that again is a catch-22 proposition when we trying to eat our favorite food and not having enough of digestive juices, and the bile acids and liver and the pancreatic juices all if they are not doing their job and they're compromised because there is not enough hydrochloric acid coming from the stomach lining, our whole of the digestive tract get screwed up. So which leads to a problem that all those mega proteins, the mega molecules get absorbed through the digestive tract, taken up into and gone into the system, into the circulation, and we start the auto immune response, creating antibodies.
Yes.
And that's the one thing when we start seeing antibodies in our system. That's when we say, yes, you have some sort of autoimmune response, and that's exactly what rheumatoid arthritis is. That once we start producing antibodies against our own, and we call rheumatoid factors and anti-CCP type of thing, that's when we give you diagnosis. But the reality is, it all starts from the gut.
It all starts from the gut. So, folks, like the gut health is very important. Like if you are having some symptoms, so just see how the diet is. So there is chances like by improving the diet and eating more vegetables and fruits and less meat and the less coffee, and we will be covering like what food need to be eliminating.
Right. So feel free to call us at 1-844-301-1250, 1-844-301-1250. The other thing which have been implicated in rheumatoid arthritis, decreased androgen levels.
Yes.
And those are the male hormones and DHEA. And there have been the people who've been supplemented with the DHEA, which is actually precursor to all the hormones, have shown some improvement. And earlier we talked about the women having estrogen issues and not a proper ratios of total estradiol and estrone and all that. Improper ratios leads to rheumatoid arthritis in the women. That's why women are more prone to
the rheumatoid arthritis.
Right. So also that means that our male population is the men usually when they get rheumatoid arthritis. One of the things is to look into the androgen hormones with the testosterone and all that. Unfortunately, the population we have these days do have, where people are having very lower level of androgen hormone, the testosterones, and then they start complaining about the joint issues. And especially, again, if there is genetic weakness, and if there is a rheumatoid arthritis in the family, these people are going to have some sort of a rheumatoid arthritis. So we do have a caller on the line, and we take the caller on the line right now. Caller, go ahead. This is Dr. Shailinder Sodhi on the show Your Body is Your Natural Pharmacy.
Hello, Dr. Shailinder.
Hello.
Hello, Dr. Shailinder.
Yes, sir. Go ahead. Good afternoon.
I'm Sanjeev from USA.
Okay, Sanjeev, go ahead.
My mother is suffering from arthritis. She also took medicine, but still she is not good. So what precautions she can take?
Okay. You mentioned arthritis. Does she have rheumatoid arthritis or just arthritis?
Rheumatoid, sir.
Okay, rheumatoid arthritis. Yeah. So Sanjeev, the one of the things which we discussed earlier is like we have seen there is a strong link between the gluten which is actually present in the wheat, gluten and gliadin. I mentioned the gliadin is gluten and gliadin. These are the proteins which are in the wheat, and they triggering the rheumatoid gene in the body and causing to the inflammatory condition in the body. So one of the things which our Indian population actually loves to
eat
roti, and which is all wheat.
Yes.
And the best thing for your mom is to cut down that wheat and possible maybe remain wheat free for a month to 2 months. And there is lots of options when it comes to is your mom vegetarian, Sanjeev?
Yes, vegetarian.
Yes, which is actually good. Though I would have liked to see if she could eat fish, but that's again not the question here. The one thing which she want to do is actually we have lots of grains in India, so which you can use like amarnath, millet, oats. These are the bajras. Those can be used. She should get used to those grains. And using lots of turmeric and ginger along with the olive oil, which are probably available in India. That would be great. And what is your take on flaxseed oil, Dr. Anju?
Very good. Flaxseed oil is great too, but it's not a direct omega-3. So fish oil is better, but for it's still like it get converted into the omega-3. Your mom can take the flaxseed, and flaxseed is easily available in India too. So she can take the flaxseed oil, or she can take the ulsi. I don't know if she takes, if she does all those things or not. And then we will be covering like some vegetables too, which she needs to avoid. So keep listening. And so she need to avoid those vegetables. There is so many things you can do to to get the results.
Right. So, Sanjeev, what happened is when you have, like your mom, I'm sure she's above 60. So, she probably use all the allopathic medications. Sometimes these, medications, it's a catch-22, which means they do alleviate some of the symptoms, but also compromise the digestion.
And it worsens the disease too sometimes. So, which is doesn't go in the favor. And sometimes like it's a symptomatic relief, and but it's not really helping with the disease.
Right. And please keep listening. We will be recommending a little bit fasting. Which is common in our Indian population. If they do fast, they do get better.
Very good. Like the fasting is fasting. She can do the water fasting should be under the supervision of a physician. So
especially if there is a chance of having low blood sugar.
So I would not recommend that to your mom, but definitely she can be on the juice fasting or the broth fasting or the smoothies. She can eat only the fruits and vegetables, and still she need to avoid some of the fruits and vegetables too. But if she stop the grains completely and the dairy,
and that's also we're talking about glutens, the wheat.
Yes, but like I would say, if she's fasting, then she has to be on the little bit different diet. So then she's avoiding all the grains too. So, we will be covering it more, Sanjeev. So, thank you for the question.
Yeah. Thank you for calling.
Thank
Okay.
Thank you,
yeah. So, Dr. Anju, the mainstream treatments are usually is like corticosteroids, and which we were touching with Sanjeev, and NSAIDs, those non-steroidal anti-inflammatory. They're usually okay to give a initial kind of relief, because people who do have lot of pain, these are the drug of choice.
Yes.
But ongoing basis, like our first caller was saying, did not want his wife to be on the synthetic drugs forever, because it does compromise later on and it leads to different issues. So for them we will be like to cover some of the alternatives available. So, what type of diet, Dr. Anju, you will recommend?
So, definitely as we discussed a little bit earlier, vegetarian diet is very good. But we recommend Mediterranean diet. In the Mediterranean diet is same as the vegetarian diet mostly. Mm-hmm. But there is a Mediterranean diet, they can eat fish.
Right.
And little bit poultry too, but no red meat.
Right.
So which is good. Fish is good. Fish is especially the cold water fish, and it should be wild. Salmon is great as well. Some other halibut, the cold water fish is good.
Right, and the richness in the olives, eating olives as it is, and also the olive oils, like you were saying earlier, have shown to be effective.
And then the lot of greens can be eaten too. But then there is some vegetables with the rheumatoid arthritis, which like the nightshade family, need to be avoided. So that like
example of nightshade.
Yeah, those are the eggplant, peppers, tomatoes, potatoes.
So they should be avoided.
These are the mostly. I do recommend to my patients to avoid a little bit of the cruciferous like the cauliflower and the broccoli they can eat, but not in the like the large amount or not like on the everyday basis.
Right, and if you are going to eat a little bit of cruciferous, then we usually try to balance the energy of food with the lots of ginger and turmeric.
Garlic is
great.
It's very important to eat the garlic into the diet,
and
too.
that's actually part of a Mediterranean diet as well.
Mediterranean diet as well.
And as we are touching the Mediterranean diet and the mentioning of the fish, one study was conducted actually right here in Seattle. About 1,200 women who were, they were advised to eat fish. All these people were who had either rheumatoid arthritis or they had genes positive for the rheumatoid arthritis. So they found, this is our local study, that they were benefited by eating white salmon. So actually wild salmon is a very good source of good fat, omegas, and good proteins. And I mean, I'm a big fan of wild salmon from Alaska.
Yeah, it's very important that do not make sure that you are not like, if some people are not aware, they are eating fish and thinking like they are eating good, doing well, but they are eating the farm raised, which has the like the mercury toxicity. So folks, like, make sure that if you are eating fish, it should be wild.
Right, and also the cold water fish, to making sure that the mackerel have shown to be good, and the sardines they shown to be, and these are the good fishes to have in the diet, especially if there is an inflammatory response in the body. And what other things you recommend in the diet, Dr. Anju?
So in the I will be there is some combinations of the food too, which you need to be avoided. Like the milk. I would suggest that avoid the dairy too,
especially the cow dairy.
And if you are like having the oats, avoid the oats with the milk. That has shown some
so you better boil in the water.
Boil into the water, or some other non dairy milk can be used, like the coconut milk or the almond milk can be used. And then there is like as we call the red meat. People eating the red meat can increase the inflammation, more arachidonic acid into the blood, so
which is
pro-inflammatory. So that can need to be avoided too. And so I think mostly the vegetarian diet, Mediterranean diet is helpful. I think we are running short on the time too. So do you want to discuss the other treatment protocol too? So which is like more the curcumin. Haldi is very good, and haldi can be taken like with the people with the having some inflammatory response.
And there was actually a study conducted where the turmeric was compared with the mainstream medication, phenylbutazone, we were discussing like earlier, and shown to be the haldi was more beneficial in treating the rheumatoid arthritis patient.
Yeah, and then there is like the haldi, eating just the haldi, like we use the spice in the kitchen. You can do that too, but then there is the curcumin, yes,
which is actually the pure color from the out of the turmeric. And that have been very effective.
That has good absorption, and by taking I do suggest to my patient by taking curcumin with little bit of the oil, which is like the fish oil works well too,
right? Or
mixing it into the
olive
oil or like the coconut milk,
right?
Like little bit of the fat has improves the absorption, or taking it with the piper.
Right.
Also
that's a black pepper, folks.
Yes.
That the other thing is, what do you think about ginger?
Ginger is great. That can be taken for the pain reduction too. So fresh, people do like to eat fresh ginger too, but then they have to eat in the large quantity. So
and what is that large quantity, Dr. Anju?
Large quantity then, because like if we are having powder form, that would be like
up to 4 grams.
Up to 4 gram, and then it like if we are having the fresh ginger, it would be about 40 gram.
So folks, when you have that fresh ginger, don't just use half of that thing. Root and crush it, and like I mince it, and I actually put it into my tea.
You can use it wherever you want to use, like in the food, in the tea. You can boil it into the water and drink that.
And there was a study conducted with the ginger and shown to be very effective in RA and OA, which is osteoarthritis and rheumatoid arthritis in both, and shown to be pain relieving action.
Pain relieving action, and the plus the ginger is good for the gut
The just-
health too.
And that's probably the one of the mechanism we were discussing.
Yes.
Majority of symptoms begin from the gut. So ginger actually helps to improve the digestion, and your food becomes less reactive. So other thing is bromelain. Bromelain, which is from the pineapple.
Yeah, that is anti-inflammatory too. So that is that's an enzyme. So it helps to break down the food. So which
And
is
so the bromelain, folks, is a proteolytic enzyme, which means it breaks down the protein. Remember when I was talking about the stomach, if you're lacking the acids, it will, the one thing which will happen is the protein doesn't get broken down. So this bromelain, which comes
Yeah.
from the pineapple stump, actually is very rich proteolytic. And also papaya.
yeah, papaya.
And this pineapple and papaya, these are the great fruit which you should be actually having in your food.
Yeah, so you need to eat more fruits because of the fruits, and eating more vegetables will give the good nutrition, like the good all those vitamins. Vitamin C. What about vitamin C? Vitamin C is very important
excellent.
too.
Again, that's good for the structure, for the ligaments, and all the synovial sheaths and all that. It really helps to strengthen them. And the one other thing is probiotics.
Probiotics is like we talked about the dysbiosis. So for that,
And the having a good probiotic like Ayush probiotic, which is a multi-strain human microflora type of, which is actually recognized by your system as its own. Those type of human microfloras are good to have. Not every probiotic is the same. I have to let my listener understand that there is a huge difference with probiotic to probiotic. So you only want to use the probiotic which is recognized by your system, especially called as a human microflora. And Ayush probiotic actually does give you multi-strain and human microflora life. So that would be great
That would be
combination
great.
to do it. And the other thing which we also talking about is the panchkarma. I will definitely consider panchkarma, which is a part of the fasting. Like you already mentioned that we need to do fasting, and this also have purging, the bastis or the animals, and also the oleation and
plus
massages.
it helps to like the it's punch. What is the panchkarma? Most of the people might know what the panchkarma is. It's a massage and the sauna. Like you get the full
5
body
steps to
massage.
detox.
It's a 5 steps to detox. So first is the massage, and second is the sauna. And that is like twice a week for 5 weeks, and then you go for a fasting and purging. You will be doing the fasting, 2 days fasting, with the with the given recommendations, juice fasting and the broth, but only the fruits and vegetables you are eating. And in the purging, you are drinking some laxative to cleanse your.
And that's the we call virechana, and virechan kriya is done. So we usually do not consider Vaman part.
We do not consider
therapy.
Vaman, but the cleansing the small intestine, and then last is the colonics to
which is a basti part.
Basti part to get rid of the toxins from the gut, especially the large intestine.
Right.
So which is very good too. And the physical, also Dr. Shailinder, doing the hot and cold. If you are at
the
home,
hydrotherapy
is very important too. Like you can have, in the rheumatoid arthritis, the symptoms get relieved with some heat.
Yeah, heat really
and
helps
the moist
with these
heat. Moist heat is more important
than the dry heat.
And then the hot but if you are having a flare up, then some cold.
So alternative. Hot and cold would be great. Like 3 minutes of hot, 1 minute of cold.
Cold would be great.
Great to do and get the circulation going and cut down. So also beside hydrotherapy and all that, we need to focus on the exercise, the yoga part.
Very important.
Because that is important for just making the flexibility, increasing flexibility in the extremities, in the joint. So doing yoga routinely.
And the pranayam as well too.
And there have been indications that these things really helps in healing when you are following along with the herbs. And one of my favorite herbs I call is the frankincense or the boswellia. We use that very effectively. And a product like Boswellia Plus have shown to be very effective in minimizing the symptoms.
Minimizing the symptoms. And curcumin, ginger, boswellia,
All these are very
probiotics. So we are covering the different parts. So, and then the multivitamins. B vitamins are very important. Vitamin D is very important.
And
too.
the majority of population is vitamin D deficient. So, folks, as we are coming to the last few seconds of the show, so remember, when you have rheumatoid arthritis, please do consult with the physicians. And if you are here in Seattle, Bellevue area, and we do have a clinic in Bellevue, Ayurvedic Naturopathic Medical Clinic, where we provide, we have been providing service for more than 30 years. I and Anju been in practice almost close to 25 years. And we see all these autoimmune cases where we help with your diet and lifestyle, and also doing panchkarmas and detox at our clinic. It helps. And we guide you step by step what type of food you should be eating, because everybody is not the same. That's the main thing when we come to and talk about the diets. Every individual is different, and Ayurveda does recognize that. So anyway, thanks for listening to the show, and we'll talk to you next week. Have a good one.